So a lot of people have questions about rheumatoid arthritis. So when we think about rheumatoid arthritis, this is a little bit different than some of the other types of degenerative arthritis that we see. In rheumatoid arthritis, your immune system actually gets overactive and it actually starts affecting the cartilage, the tissues surrounding the joints. It can actually start to cause joint destruction. And in fact, this inflammatory process or this body fighting itself can actually get to the point where those antibodies in the blood are actually starting to affect the lungs, the heart. They can affect other organs. So rheumatoid arthritis can at times be a very serious disease, in addition to just causing the arthritic pain that many people are concerned about. In terms of causes of rheumatoid arthritis, we don't really know. We know that something in the patient's body triggers off an immune response where the body's immune system starts to attack the cartilage, the surrounding of the joints, the synovium, and causes this irritation and destruction of the bone. In fact, if left untreated, you can actually get some very severe joint destruction. You may have seen pictures or even known somebody whose hands were deformed by the arthritis. So rheumatoid arthritis can cause that joint destruction, and that's why sometimes some very aggressive treatments are needed to help protect the joints and make sure that that doesn't happen. In terms of what you can do to treat rheumatoid arthritis, I think rheumatoid arthritis is a little bit of a tricky disease, because we know that it can have some very serious effects. We know that it can actually destroy joints. We know that it can affect the lungs, it can affect the heart, it can affect other organs, so it can affect your blood counts. So this is certainly a disease where on the early side, if you think you might have it, you want to see a physician. The good news is that there are lots of treatments that can be quite effective. Some of them do involve costly pharmaceuticals, and sometimes those are needed. But sometimes there are some simpler treatments that can actually be quite effective. Tai Chi, believe it or not, has been shown to be effective. You might have even seen the commercials on TV with Dick Van Dyke selling his Tai Chi product. Again, Tai Chi, which in Chinese medicine is a series of motions, gentle, stretchy motions, but what we found is that it helps improve balance, and it also helps keep the mobility in the joints. So Tai Chi, either by video or preferably I think joining a local class, could be a great option if you have rheumatoid arthritis to help with your mobility. We've also found that low-level laser can be helpful in treating the joint pain that's associated with rheumatoid arthritis. Acupuncture can also be beneficial. We know that acupuncture, when the needles are introduced into the skin, it helps raise your body's endorphins. We know that it also changes some of the hormonal levels. So we have found that acupuncture in Chinese medicine can also be quite beneficial in rheumatoid arthritis. I've also had a lot of rheumatoid arthritis patients feel better when they get osteopathic manipulation. As those joints get stuck and stiff, the gentle hands-on treatment, and we're talking a very gentle treatment, many of these patients feel much better when they get regular osteopathic manipulation. So that's a very overlooked, very simple thing that you can do to help your rheumatoid arthritis. Finally, there's a lot of evidence that suggests that diet can actually play an important role in the treatment of rheumatoid arthritis. We know that there's certain things that many people eat that do tend to keep the autoimmune process going. Things like gluten, things like dairy can really fire up that process and really keep the inflammatory process going. So I've had a lot of patients have really good success staying on a plant-based diet. And so a plant-based diet where they're eating almost exclusively fruits and vegetables can be very effective in helping to lower inflammation, the systemic inflammation, and help you get into remission where the rheumatoid arthritis isn't active. So the plant-based diet is an excellent place to start if you're looking for how you can help in your treatment of rheumatoid arthritis. Again, because rheumatoid arthritis is can be such a challenging disease, because it can have such wide-ranging effects, I do recommend that you have a physician help guide you in that process, because even though all of my patients know that I try very hard to do things as naturally as we can, this is one disease where sometimes we do need those medications in order to avoid some very serious effects.